So, good morning, good afternoon, good evening, and hello everyone to whichever part of the world you are in. And this is a YouTube live as well as an Instagram live for an interesting upcoming workshop which I will be conducting with Dr. Anshu, and it is titled introduction to it is titled the Kingdom Differentiation Workshop. Although in one short live session we cannot do that, but today will be a glimpse of what will be the knowledge a participant will be getting in this interesting workshop, which is starting in the month of April, just this month and 2 days from now. So let us start with an interesting case, and it's a case of migraine, and the patient is 28-year-old, female doctor who was seen by me in the month of October, around roughly around 15 October 2020, and she had a very bad headache which kept on tormenting her. Every 15-20 days, the headache used to happen, and it's a kind of a headache which disturbs her a lot. She is a practicing doctor, so she gets affected with it, and this is the reason she would like to take medicine. In spite of taking all the medications that she already could, she was not. So there was a situation where she found it difficult to continue her practice. She had to take leave from the clinic, and her patients also suffered because she was also suffering with a bad headache. And this happens with many medicos because of lot of issues, lot of stress, lot of personal issues, etc., etc. So we go into this case and we try to understand what was the detail, what was happening in the case, and we try to find out about what's you know uh, what will be the case details, case analysis, and how we will differentiate the kingdom and reach to a particular remedy, and how will the analysis happen. And this will give you a glimpse of what the kingdom workshop will be, what we will be doing in the kingdom workshop, which is starting on 23rd April, which is just 2 days from now. So let me begin with the case. All right, just a moment. And yes. So the case goes like this, that she has a semilateral headache, and it happens every 15-20 days, and she cannot see anything. She reported to me in the month of October 2020, but before that, there was COVID lockdown, everyone knows about it, and she had to join a local hospital because she was graduated and she had to work and do something. So there were constant night duties and there was irregular sleep pattern, and she was starting to have the complaint of headache, and that is why she started taking treatment from a senior homeopath, a very well renowned and known homeopath, and she was okay with it. But because of her duties and her irregular timings and her own planning for opening the clinic, she couldn't go to the senior doctor, and that is why she reported to me, which she found was very beneficial. So when she shared the entire complaints, she told that when her stools are not good, there is a headache, and when her sleep is not good, there is a headache, which is most of the cases of migraine always have it. Now, what details about the case we get is that her scalp is too sensitive and there is a lot of hair fall also. And she also got married in that period of her struggle of graduation and looking for duties, and also having that irregular pattern of sleep and irregular duties and managing the COVID scenario. So she got married in somewhere in July or August 2020, and due to some or the other reasons she had to separate from her in-laws, and they stay in the next building. And one of the major things she voluntarily told was that she doesn't like dirtiness, and she gets very angry. So this was the one of the places where when she was sharing about her details, and being a homeopath, she knew that these details are important, so she voluntarily shared all those details. And she told that this dirtiness irritates me, and it came with a kind of a hand gesture and lot of expressions on her face, on her mouth. And it gave a feeling that this is where the energy is. Sometimes you feel in the case that there is a lot of energy in the case, and if any symptom of a patient comes with a particular hand gesture, it becomes all the more important. So once you understand that, you record that symptom, you record that observation. And it was just a kind of overwhelming of emotions, because she doesn't like the dirtiness, she doesn't like the the messy situations in her home, or around in her clinic, or outside wherever she goes. And she gives instructions to do this and that to clear it. She also had past history of gastritis, recurrent boils, sun allergy, and corns and warts. But nothing was there now. She had taken treatment from some other homeopath when she was studying as a student, when as a homeopath when she was studying. Now, also about her case, she shared that there was lot of acne and skin disturbances before her menses came. During menses, there were lot of abdominal pain, leg pains, which was pretty normal, and there was lot of perspiration in the axilla, lot of staining of the perspiration. And when you see the physical journals, there was nothing much particular, but there were dreams of dead people and also dead bodies. So this became all the more important. And when I asked something more about herself, her nature, she told that, because of this headache, I am becoming all the more irregular in my clinic. And I need to take the leave from clinic. I cannot go to clinic because it is such a maddening pain that I don't know what to do. And being a new doctor in my locality, it is not good. Everyone has an image, and I need to maintain that image. So you could see that, you know she doesn't like to be irregular. No one likes to be irregular. Everyone has a different feeling when they say that they are irregular. They are not able to meet the standard what a doctor should do, what a new homeopathic practitioner, or what a new practitioner should do in the locality when they open the clinic. So she felt that it's a image which I need to maintain, and because of this I am not able to, because of the headache, I'm not able to maintain that image which a doctor should have in the society. Someone else would say that I need to earn money. Someone else would say that what my patients would say if I am also suffering, and if they get to know. So, there are different expressions which different people will complain, and we need to catch that, and we need to make a note of them. So when you bring all these things together, and you see that the background of the case, where she told that she had a very strict upbringing. Her grandmother was strict, her kaka was strict, the father's brother. Her father was strict, and they used to live in the joint family, and there was a constant fear that someone will scold, and someone will tell something, and something bad will happen. So This was a kind of a sensitivity which the patient had. Now, based upon only one expression, we cannot just classify it as plant or mineral or animal, but we need to bring everything on table, every symptom and every expression of the patient collectively, and see what is it that classifies the patient's totality, and then analyze it further. So once we do that, and she in that period of her struggle, she also developed a skin infection which she told. And she felt bad because she comes from a lower community and her husband belongs to a better community, and the in-laws used to constantly tell her. So she used to have this same feeling which she had in her childhood, that someone will tell her something and she'll feel bad about it. So you can see that that commonality of her state is always present. And when you bring all the symptoms together, there is dreams of death, there is fastidiousness, there is sensitive reprimands too, there is perspiration exhala, which is staining the linen, there is, skin symptoms before the menses. So you see that there are some symptoms of the patient which you can classify into rubrics. And once you take the rubrics, you get a group of remedies. You cannot think of the plant, mineral, or animal right now, because it has already been listed in the case, and you just need to bring the symptoms of the patient on a page where you'll see some remedies, and then go back to the case and see what are the locations where the patient has emphasized upon, whether it was something related to sensitivity, whether something related to image consciousness, whether something related to her financial status, her struggle, etc. etc. And when you take these rubrics, firstly, you take the rubrics, and when you take the rubrics, you see that there is this kind of a remedies which are coming, which is thuja, graphitis, lachesis, silica, quinine, hepar, lyco, arsenic, sulfur, calcarea, and so on and so forth. So let me show you the analysis, which will give you an idea of what the remedies come from the repertory sheet. And in that way you will be able to understand these interesting remedies which always pop up in your screen, and what you can do to understand and bring them together. So now when you do this and you have something to look forward to, that what will you take for analysis, what will you do in the patient for analyzing the case and looking into plant, mineral, or animal. And you see that in her case she has all the time emphasized upon sensitive to reprimands, of course, but also the image which she needs to maintain for as a new practitioner and as a new doctor who is set up in the society. And secondly, what you see is that there was kind of a acute headache which totality is classified separately, and you can see that this was a kind of a totality which was taken for the acute headache, head pain, general one side, and sleep loss of from. And you can see that it gives you pulsatilla, cocculus, nux vomica, bryonia, phosphorus. And one remedy amongst this was chosen as her acute, because this is what every homeopath should do. Whenever you have a case which is a long standing and chronic case, you need to have a chronic totality at hand and an acute totality at hand. One of the remedies was chosen. What remedy was chosen, I will share very soon. So before proceeding about sharing the remedy, you can see that I shared that there were many remedies coming in the chart, which were thuja, graphitis, lachesis, silica, conime, hepar, lyco. Now, when you go back to the case, after taking the symptoms, when you go back to the case, you see that there is a kind of a, essence of a silica, where she needs to maintain that standard, that image consciousness. But there was also a kind of a struggle. There was also a kind of a, what do you say, kind of a financial struggle which she had with her partner with whom she got married in that phase. So this becomes all the more important, where you get a remedy which is a combination of uh, you know image consciousness as well as that struggle and that financial importance which the remedy always wants. So when you see the repertory graph and you know that there is silica already coming in the third or fourth uh, remedy number, and down the line you see calcarea. So now you can think of some compound which is a combination like Calcarea silicata. And I started her with Calcarea silicata 1 m twice a day for 2 days. And the acute medicine chosen was pulsatilla. Now, why pulsatilla? I will be sharing about it very shortly. But as we progressed further in the case, I could see that there was very less attack of headache in the 15 days. Uh, she didn't have any episode of headache, and also she didn't require to take any medicine, as well as acute as well as chronic. And interestingly, she ejected a stone which is kidney stone which was 3 millimeters, and there was kind of a burning in the stool region earlier, but that improved. And there was kind of a good improvement. She could feel the energy. You can feel that in the follow-up the patient is sharing all the positive symptoms, more of positive symptoms than the negative symptoms, or than the things which are not improving. So you can sense that the patient is improving in the right direction. And by the end of November, she was just having one episode of headache. She was again given Calcarea silicata 1 m twice a day, and pulsatilla was SOS. She didn't require pulsatilla to be taken in the last 45 days. And by the end of December, just one episode of headache. And interestingly, by end of December, she had warts, and because of warts she had a little bit of pain. And if you see the case history again, for those who are seeing this recording afterwards again, you can go back and check again what I conveyed earlier, that she had some corns and warts earlier. Now these warts and corns were coming exactly 3 months after, 3 or 2 months after treatment rather. And this was a miracle because uh, you know some externalization of disease is happening, and that needs to happen when a patient is improving. And by Jan and March, there was very less episodes of headache, and she just required 2 doses of Calcarea silicata. Why the medicine is repeated is because there is a kind of a struggle which the patient experiences in her life, and because of that struggle, the patient gets back to a, an earlier stage of affection, which we do not want the patient to fall, and we need to bring them out from that phase. And that is why we can give Calcarea silicata or the indicated medicine again after a month or 2 months. And that is what I did. By November I just gave 1 dose, December no dose was given, and Jan and March another 2 days doses of Calcarea silicata were given. And that is how she improved. Now when we go to the analysis, what we can do is, with the analysis, you can study a remedy by symptoms, and you can study a remedy by themes. Okay, so let me show you what I have prepared for you all on the screen, and you will be delighted to what you will be studying today. And you will never forget this remedy, because this is what the remedy uh, is, how it is conceptualized. So when you see that how you study a remedy by symptoms and how you study a remedy by themes, you can see that by this method you will be able to reach either symptoms or either themes. And if you need to reach both of them, you will need to understand the remedy from a deeper analysis and deeper part, which is what we will be doing right now. So if you see the materia medica of Calcarea silicata, it is a deep acting, long acting medicine for complaints which come on slowly and reach their final development for long periods. You will not get much about the mind symptoms of Calcarea silicata because they were never, it was never proved in that way, back then when these authors wrote their books. And that is what we need to understand, and we need to uh, study about these remedies. And then when you go back and when you see that Clark, what Clark mentioned in this particular remedy was that there was, it was used by some author at some of the time in cases of atrophy of children, but nothing more was mentioned. So you can see that this is a kind of a limitation of seeing these smaller remedies which have not been proved by earlier authors. And how will you reach these smaller remedies or less proved remedies from your from the current authors is by doing just one thing, and that is by either studying the repertory where you will see that there is some rubrics mentioned about Calcarea silicata, but still it is very less. So what you can do is you can go to a bigger repertory, but there are many rubrics, and some of the rubrics will give you a broader indication of Calcarea silicata. But what is the best way to study is, you know, to go to the doctrine of signature. And when you see the doctrine of signature, it says that calcarea and calcarea silicata is composed of two parts, which is calcarea and silicata. Calcium is soft, lightweight, grayish white, limestone, marble, chalk, gypsum all have it. It serves as a skeleton for corals. Marine construction industry uses it a lot. And silica has the very good abrasion resistance, high thermal stability, and that is why you can see how it needs to maintain the image consciousness, the image, image feeling which the patient always has, and how it is used in optical fibers, ceramics, and it is insoluble in many acids, so it needs to maintain its structure. When you learn these two components from materia medica, you will see calcarea has apprehension, silica is very submissive, but yet it is most obstinate, the opposite spectrum. And calcarea fears misfortune and loss of reason, and also has forgetfulness, whereas silica has lot of yielding nature and it is nervous, faint-hearted, it fears that it will fail, and it is very sensitive. And from the repertory, if you study the two components, you see that there is calcarea, which has fear of being observed for her condition, and silica, which has pedant nature or fixed nature, and it does. The very interesting symptom is there, which is colors aversion to bright. So it does not want limelight. It does not want to go in the limelight and enjoy that limelight which phosphorus likes. So when you bring these two components together, you know that this Calcarea silicata, animals need calcium, whereas plants need silica. And most of the primitive plants were composed of silica. For example, spongia, it contains a lot of silica. So you have the weakness of calcarea, you have the weakness of silica. And someone who is doubly weak and he needs a lot of support. That is where you come to calcarea silicata, which, you know, gives you understanding that it is indicated in young age. It is indicated in people who are stuck in a life stage where lot of struggle is there, lot of things are yet to be achieved in life, lot of responsibility is there, and she needs to fulfill that with a lot of struggle. So that is what calcarea silicata is all about. And if you understand this aspect of calcarea silicata from the doctrine of signature, from the materia medica, from the repertory, the two components calcarea and silicata, then you will be able to understand calcarea silicata as a remedy. And that is what we will be teaching in this upcoming workshop. It is just like, connecting the dots in different for different making different shapes, different animals. And similarly we need to connect the dots in homeopathy, where you need to understand how to bring things together from doctrine of signature, from materia medica, from repertory, etc., etc. So what do you expect on this YouTube channel, the Facebook page, Interning Online, and Instagram page, which is Interning Online with Dr. Oza? Lot of clinical experiences. If you haven't seen that, please go and see that, where you will get to, different ways to use the repertory, different ways to locate patient symptoms and form into rubrics, posts about various cases of different repertories and materia medicas, and much more. And interestingly, there is an upcoming workshop, like similarly how you saw today, how a case of migraine was treated using a very lesser known remedy, Calcarea silicata, whose mind symptoms are not elaborately mentioned in many of our materia medicas. So you can see that there is this workshop, which is uh, Kingdom Differentiation Workshop, and you can get all the details of this workshop in uh, our Instagram page and Facebook page as well. And that is what you can understand from these type of workshops, where you will be able to uh, get across different cases of plants, minerals, and animals. And you can register for this workshop uh, by contacting us on the WhatsApp number. It is available on our profile. For those who are seeing the YouTube live, they can go to the description and fill up a form for understanding how to approach and how to understand different kingdoms, plant, minerals, and animals. And the its session will be on Google Meet, and it's a 10 days intensive workshop. So I hope to see you all. And those who are seeing Instagram live, this recording will not be posted. If you would like to see it, you can see it on the YouTube channel, which is of my name itself, Alpesh Oza. And you will be understanding about different such workshops which we will be coming up soon. And that is what we are here today to share about this interesting remedy, Calcarea silicata. So once you understand this, you will be able to uh, you know take a leap in your cases, and take this further and develop your confidence in tackling different cases where plants, minerals, and animal remedies are required by patients. And that's it about all about this remedy, Calcarea silicata. I hope to see you all in this workshop, and again tomorrow we will be having another interesting remedy at the same hour. So stay tuned, and we'll have an interesting discussion. For those who wish to see, the someone has told on Instagram that mere spec. Please cover the whole screen through the camera. Please go to YouTube live. I will try to put the PowerPoint somehow on my profile. And on YouTube some people have commented that you need to learn case taking, so you can fill in the description, the Google form in the description below, and we'll get back to you about how you can learn case taking in different cases, and how to start your homeopathic practice. That is also important. And stay tuned for upgrading your knowledge of homeopathy. कपड़ा एक ज्ञान